Hello everyone, this is Dr. Aditya Gupta. So in this exam, I'll tell you the secret of cracking INI-CET and how it's better actually if you prepare for INI-CET in mind rather than NEET PG in mind. See, NEET PG is on June 15th, INI-CET is on May 17th, 18th if I'm not wrong. If you prepare with INI-CET in mind, what is going to happen? You'll actually have 1 full month to rectify your mistakes that you can improve in NEET PG rather than if you go for NEET PG and that becomes, one single day determines your entire fate. And just in case if you get a good rank in INI-CET, then obviously it's much better to do your residency in a central institutes for many branches rather than going for a state college. Right. And INI-CET, I feel, as we all have seen with the latest fiasco, with the counseling fiasco, we have seen with the delay fiasco and everything like that, that it's an objectively better exam. You know that it's going to be conducted on that day. You know that there will be timing results. And as an exam also, you have to understand it's a very predictable exam. It's not neat, unlike NEET. Even NEET is a very predictable exam, to be very honest. But INICET is an even more predictable exam. Again, going towards that, it tends to repeat its topics, previous year topics more often as compared to NEET. All right. Now, what I'm going to tell is exactly what I did. I gave November INI-CET in 2017 and I got a 1700 rank. And I converted that rank from 1700 to an All India rank of 17 in May 2018 AIMS PG. Basically a 100x improvement. So even if you are someone who got a 30,000-40,000 rank, you can easily get a 300-400 rank. Don't underestimate yourself. Don't think that you are not capable. Just put in the efforts with a little bit of directions and you will get that rank that you desire. But you just need to keep in the efforts and a little bit of direction. That's it. And even for the top branches like, radio, they are going like 200, 150, 200. So you have a decent shot at all the good branches if a little bit of luck is favoring you, right? Now there are three pillars that determine and that are how different they're different as compared to in INI-CET as compared to NEET PG. What are these three different pillars? One is the first and second prof focus. The second is a heavy focus on previous year topics, not just past 5-7 years, but even from 13, 14 or 15 papers. Alright. And the last is a good last 7-day revision, and I'll talk about that also. Let's discuss these pillars in depth. First, let's talk about first and second prof. So you have to understand that unlike NEET, where the distribution is final prof being, the third and fourth prof being 50% or maybe 55% and first and second prof subjects being around 40-45%, it's actually reverse in INI-CET. INI-CET, 60% of the paper, around 110 to 120 questions will actually be from Path Pharma Micro. All right. And I know this because I was there for 12 years. I know I've interacted with professors. I have a little bit of idea, a little bit of insider information on how AIMS actually makes its paper. They actually prefer first and second prof. They are a USMLE focused exam, sort of. They want to emulate USMLE and they give more questions from first and second prof, where first and second prof will actually have weightage close to 110, 120 questions rather than final prof. And amongst that, the major differentiator from NEET actually is what? It's actually anatomy and forensic medicine. Anatomy in NEET has probably around 5 or 7 questions, while in AIMS or INI-CET it will have what? It will have 200, 200, it will have 20 to 25 questions. Same for forensic medicine. Instead of having 5 or 6 questions in forensic medicine in NEET or maybe 10, here it will actually be around 15 range. And anatomy is one of the major subjects which a lot of people don't end up having a good hold of. And that can be a big differentiator. The biggest example is my best friend Rishabh. He was amazing in anatomy. Result, All India rank 4. I improved my anatomy and I feel it was one of the major reasons I got a All India rank 17 and improved from my 1700 rank actually. And apart from that also, Path Pharma, in NEET, there will be around 15-16 questions from these subjects. Here it will be 20-25 questions. In fact, I always say in my videos, if you have done your Path Pharma Micro properly, you can actually leave medicine because Path Pharma Micro is nothing but medicine. You can actually leave medicine apart from doing just your emergencies, just your things which you do in your internship. And because first second prof is so heavy, that's the reason why first aid is so helpful for INI-CET. So have a focus on forensic medicine and anatomy and first and second prof if you're preparing for INI-CET in mind. That's one major thing. Second, previous year questions. Now, I know that previous year questions and their topics, everyone knows. Now this has been made, everyone at least now knows that yes, around 70 to 80% of the paper is going from previous year topics. Everyone knows that. But here in case of INI-CET, they have a tendency to repeat verbatim questions from a little prior paper, from 13-14 paper. There are multiple tweets on Twitter after this November paper that questions, verbatim questions, like line by line questions actually came from 14, 15 and 16 paper. For that, I would actually recommend what? I would recommend that for 10-year papers, I would recommend Reflex. For those who don't know, today is my father's birthday. He would have been 59 years old. He unfortunately passed away in 2021. He would have been 59 years old today. So for Reflex, it's like my own app. So we are offering a 20% discount today with the code Sanjay59. This birthday. And it's only valid for today or tomorrow, right? So please grab the offer if you're thinking of getting Reflex. Now coming back to the previous year topics, coming back to INI-CET is like quite literally, that's why people say it's a easier paper to attempt as compared to NEET. Why? Because in INI-CET, some topics are very frequently repeated. There is going to be a question on glycogen storage disorder. There's going to be a question on GCS or some score. There's going to be a question on pneumothorax. There's going to be questions from Nina Khanna images. There are going to be questions from, central pontine myelinosis, hypohypernatremia. One question is almost a given. So INI-CET, you actually have an idea what kind of paper you're going to expect, rather than being a totally unpredictable paper, which can happen sometimes as far as NEET is concerned. Question on RET, question on Digeorge syndrome, question on immunity being very, very high focused. All right. So most apps actually give 6-7 year papers. They are adequate. I'm not saying they're inadequate. You should do at least 6-7 year papers. But if you're actually targeting a top 500,000 rank, you should go for Reflex. That is one delta. That is one advantage. This year, All India rank 1 for everyone who got this time INI-CET, Webhav, Nisargi, and all. These are my juniors. They all told me how Reflex helped them. So definitely go for Reflex. All right. Now coming to the third part, the revision plan. So this is the simple revision plan which I followed, to be very honest. I had done my first reading by around, I would say, December. After December, I started to revise. So I did my first revision in Jan, Feb, and March actually. Mid-March actually, not pura March, mid-March. What you can do, since you're starting from 20th of January today, let's say, try to complete the revision by end of March. Then try to do another revision in April, if possible. If not possible, maybe you can extend a little bit into May. In May, you will have 15 days before your INI-CET actually happens. That 15 days you will keep in two different categories, I would say. In the first 5 to 7 days of May, what you should do is you should revise the big subjects, the medicine, the surgery, the obs-gynae, which tend to have a more retention power. You don't tend to forget them. You've already done them in your final prof, right? Last 7 days, have a focus on revising the first, second prof, minors, obs-gynae. Definitely you should consider surgery, but you can actually skip medicine. Maybe even if you revise medicine 15 days prior to exam, it's still going to stay. But ensure that you revise path pharma micro. Ensure you revise first, second prof. Ensure you revise your minors in the last 7 days, and then give the exam. That's a very simple, straightforward strategy. All right, nothing too complicated. Don't have too many complications. Don't think of here and there. Don't be in FOMO. Whatever you're doing, just revise that properly. Ensure to concise it so that you can actually revise it. Can make concise notes so that you can actually revise it. You can use a resource for consideration. You can use one shot. You can use BTR. That's up to you. But the entire focus is 2 revision, 1 final 10 to 10 day revision with focus on first and second prof, particularly on anatomy, along with minors, and give the exam. From the mistakes that you make, even if you make a mistake, no harm. You still have 1 month to go for NEET, and you can improve from that. All right. So these are the 3 pillars, simple pillars. Focus on first, second prof to have a top 10 rank, top 100 rank in INI-CET. Do past 10 years papers from Reflex, and have a revision plan. I'll make further videos on the proper revision plan that I followed, what you can follow depending upon your strengths and weaknesses. And that's it from my side today. Thank you and have a nice day.